Role-playing at a glance.
Role-play must be carefully developed to achieve its objectives.
First, you need to define the role-play objective. In Ano the Meme, why you want to include role-playing exercises in your course. In our case, is to enhance building positive relationships with the patient.
Second, choose your role-play context. Decide on a problem related to the chosen topics of study. And do not forget to make the setting realistic, but not necessarily to be real. Let us see an example. As part of the Nursing Care of Adults course, Dr. Alia wanted her students to build positive relationships with their patients while they are giving instructions to the patient on how to use certain types of medicine. Dr. Alia decided to give the students a case and let them practice the conversation with the patient. Let us consider the setting is the medical clinic, and the story is, your 60-year-old patient has type 2 diabetes, which has been moderately well controlled by diet and oral medication until now. However, recently the patient's blood sugar has been high. The doctor has decided to commence insulin injectors. You are seeing the patient to show her how to administer injectors.
Decide on who will play the roles. It is best to have only a few actors in the episode. Many players may confuse the issue and the objective of the session. In our case we do but need more than an elderly female patient and a nurse.
Next step is to have warm-up sessions, especially if your students were not engaged in role-playing sessions before. Facilitator ought to feel free to select any activity that can simulate students' thinking. As an example, Dr. Alia decided to ask members of the class to suggest ways in which they could help to build a good relationship with the patient, either as group work or brainstorming sessions, etc.
Now we are ready to introduce the exercise. Engage the students in the scenario by describing the setting and the problem. And provide them with the information you have already prepared about the case and their characters. In our example, the facilitator will introduce the setting, problem, the prepared case, and the required characters with the following details to ensure achieving the patient's visit goal. First, confirm the reason for the appointment, self-administering injections for diabetes, advice and observation. Find out how the patient feels about insulin injections. Second, explore reasons for the patient's anxiety, injection process, fear of needles, etc. Third, reassure the patient about managing injections, for example clear instructions, easier with practice, etc. Stress the importance of insulin injections, e.g. faster absorption into the bloodstream. Fourth, emphasis injections are the best option, for example current management, not working. Explain the injection giving process and describe the need to rotate the site. Fifth, explain importance of safe needle disposal, for example suitable container, etc. Outline insulin storage and establish patient's willingness to be observed self-injecting.
Now your actors and other parties need to be prepared for the scenario. The students should understand the educational purposes of the drama and how the issue or problem is relevant to them. In our case, the purpose is to enhance building a positive relationship with the patient. When healthcare provider attempts to build a better relationship with patients, there are two benefits. First, the healthcare provider can better understand the individual medical history and treatment requirements, and can better understand their care and needs options while allowing them to make well-informed decisions. Second, the more an organization can understand a patient, the more they can give them individual treatment, resources, and care plans. The stronger the relationship with the patient, the more possible these tailored resources and data will resonate and encourage retention efforts. In our case, we need to remind our students that the good relationships lead to positive patients' experience. Patients who feel more connected with their healthcare provider experience more positive outcomes. Having a strong relationship with patients demonstrates the positive value that is above and beyond quality care and treatment. Strong relationships promote patient satisfaction. Patients want to be sure their healthcare provider takes time to provide them the individual care they need and is providing them the care they expect. Patients are involved in their care. Patients value more when they are involved with their provider while undergoing their treatment, and they want to be connected with other staff who are involved with their care plan. This involvement results in making informed decisions.
Do not forget, the teacher must be careful to select the proper students to play given roles. Good to start with socially competent students, then move toward the involvement of students in greater need of help. Student should feel free to decline a role if he feels uncomfortable. It may be better to involve him as an observer or a reactor than as an active participant.
Briefing the actors with their role is the base to start the role play. A description of the role or of the character's feelings or history may be written out on a slip of paper and given to the actor.
Audience also have a role. They need to be oriented on it. The students who are not acting out dramatic roles can in some cases observe the general interaction of actors. In other circumstances, the teachers can ask them to be identifiers to identify with the feelings, thoughts, and actions of actors. Identifiers differ from observers in the degree of their empathy and sympathy with the action. In our case, the purpose is to enhance building a positive relationship with the patient. This can be done through several strategies. In this exercise, I want you to utilize the following strategies. First, initiate the interaction appropriately, such as greeting, introduction, nature of the interview. Think about how to begin the interaction. Is this the first time to meet the patient? Is the patient distressed? Need the empathy from the beginning. Second, do not forget, you need to demonstrate an attractive and respectful attitude, listen to the patient carefully, and respond in professional language. Third, you need to adopt a non-judgmental approach. If you can try and exercise this, would help you to use the needle without fear. Fourth, you need to show empathy. Use tenses such as I understand that you are worried, that must have been very scary, I can see that you are concerned, etc. As facilitator, you may divide the rest of the class into two groups. One group watches the nurse student, and the other group observes the patient students. Each audience group need to be charged with the responsibilities of observing what each member of their actor team did, evaluating the effect on the comfort of the other student, evaluating the way the actor might have felt while doing this, and suggesting other things that each student could have done to make this introduction period easier.
Multiple role playing by several teams simultaneously can give each class member the opportunity to play a role or to test his own solution to a problem. Additional suggestion for our case, you may divide the students into groups and ask each group to practice in their context as discussed previously, then select actors to demonstrate the scenario in front of the class. This will ensure a full understanding of the case and everyone can participate effectively.